Well, today on the show, we're at the Gulfport location of Bienville Orthopedic, talking to Dr. Henry Leese. How are you, sir?
I'm doing great, Jim. Thanks for having me.
Well, thank you very much for letting us come over here. I mean, we've been to other locations of Bienville, but wanted to come visit with you. Give us a little bit of background about yourself, if you would.
So I attended medical school in Washington, D.C. at Uniformed Services University in Bethesda, Maryland, and then attended orthopedic surgery residency in San Antonio, Texas, and an upper extremity fellowship in shoulder, elbow, hand, and wrist surgery, also in San Antonio.
Why orthopedic? I mean, there's so many different fields that you can choose from.
Sure. So I was an athlete in high school and enjoyed the sports medicine aspect of orthopedics. As I continued on through college, I had a strong desire to become an orthopedic surgeon.
We're going to be talking today about carpal tunnel, things like that. A lot
Correct.
of people suffer from those kind of problems, especially nowadays sitting at a desk on the computers all day long, which affects them so much. Tell us some of the latest techniques and technology for patients.
So some of the most common things I see from shoulder to fingertip, carpal tunnel syndrome, which is pressure on the median nerve at the wrist, cubital tunnel syndrome, pressure on the ulnar nerve at the elbow, and CMC arthritis, and also chronic tendinopathies. And a lot of them are caused, like you said, from ergonomic positioning in a computer workspace and also from repetitive use. So some of the newer things we're doing are minimally invasive techniques, utilizing new technology with endoscopic procedures for both carpal and cubital tunnel, arthroscopic procedures for arthritis at the base of the thumb, CMC arthritis, and then percutaneous ultrasound guided techniques for common chronic extensor tendon and other tendinopathies.
So what is the difference? And I have to refer to my notes here because I can't remember all these big words. Endoscopic cubital tunnel release versus carpal tunnel release surgery.
So
What's the difference?
So one is at the elbow. So carpal tunnel is the most common. That's pressure at the median nerve at the wrist. We do that through the video camera through a small 1 centimeter incision while viewing the nerve on a video television screen while we're releasing it. Cubital tunnel is pressure on the nerve at the elbow, which affects the ring finger and the small finger. The carpal tunnel will affect the other 3 fingers more commonly.
Arthroscopic, CMC, arthroplasty.
Right. So
why do y'all have all these big words when it comes to this?
it's all Latin, right?
Yeah, really.
So that is, I'll show you here on the model, the most common site for arthritis in the upper extremity is the base of the thumb. And if you look at that joint, it's shaped like a saddle. Over time, because of the great mobility of the thumb, the saddle starts to wear down. The bone actually changes shape and the bone of the metacarpal will shift. And patients will come in and complain of a bump at the base of their thumb. So this is a technique where instead of what the old surgery we used to do would be make an open incision, remove the entire bone, take a tendon from the forearm and put it in as a spacer, we're now able to make 2 small incisions through the video camera, remove bone on both sides, which relieves the patient's pain and symptoms.
Oh, wow. What kind of recovery time is there with that?
It's a much quicker recovery from the big surgery, and I still do the big surgery in some severe cases.
Right.
That's about a 6-month recovery. For the smaller surgery, patients are back doing sedentary office type work within days to weeks.
Really?
Full recovery time is about 6 weeks.
So what are the overall benefits?
So I think the benefits with most of these newer techniques are that it's less invasive, that the patients are able to return to work and activities sooner, and they seem to have somewhat of a quicker recovery and less pain.
Okay, another big word here. Carpometacarpal joint replacement.
Joint replacement, sure. So that's the base of the thumb when it's so severe that the arthroscopic techniques don't work. Then we talk about replacing the base of the thumb joint. There's several different new techniques that we have. Some of it is carbon fiber, so similar to products that the space shuttle is made out of, or stealth fighters, stealth bombers. And it is very durable, lasts a long time, and gives good pain relief also.
And it's, like you said, the whole area, like from the elbow down, is where you deal mostly with the patients nowadays.
Yeah, so
that work in those kind of environments.
Sure. My practice is shoulder, elbow, wrist, and hand, and so we do arthroscopic rotator cuff repairs also, which is minimally invasive compared to the open shoulder techniques. In addition, we do some treatment, and I think you're gonna touch on that in a second, on TenJet procedure.
That was my next question.
Yeah, and so that's a really neat technique. It's been around for a while, but it's taken a little bit for us to get up to speed on the coast.
I don't know, a month or two ago, I talked to Dr. Mullins about that.
Right. Dr. Mullins is our foot and ankle specialist.
Right, exactly.
So it's used for chronic tendinitis. So we see that with plantar fasciitis in the foot, chronic Achilles tendinitis at the ankle, tendinitis at the knee, and then in the upper extremity, I use TenJet for both shoulder and for elbow, which is tennis elbow, which is very common.
Okay.
People have chronic inflammation of the tendon lateral epicondylitis at the elbow, and that gives them relief. It's a more of a procedure than a surgery. It's a very small incision where you can introduce a probe about the size of the tip of a pen, and you can release the tendon while looking at it via ultrasound.
Wow, technology is amazing.
Yeah.
The way it's come from years gone by.
Definitely.
And I had a question and it just is gone. What age group do you see most of? I mean, I'm sure you see both young and old.
Correct. So for the tendinopathies and the tennis elbow, Achilles tendinitis, a lot of times these are younger, more active people who are involved in recreational sports and other activities. For the degenerative problems, rotator cuff tears, arthritis at the base of the thumb, those patients tend to be older patients, 50s, 60s, and 70s, and it's more of a wear and tear process.
So over a period of time, you know, people getting these little aches and pains, not sure what they are, that deterioration could be going on, and it's best to catch it at an earlier time. I mean, as you said, when you have that joint in there, as you showed us on Charlie over there, if it lets it go too long, it could be a lot more to go into getting it repaired.
Sure, absolutely. It's always early to catch things early if you can, to catch these problems, to diagnose them and treat them, because if we catch it early enough, a lot of times the treatment is non-surgical, conservative, medications, splints, injections, things of that nature.
And usually you can go in and get it done in the morning and head home that afternoon.
Almost all of these surgeries that we talk about now are outpatient surgeries, same-day surgeries done at an outpatient surgery facility. Very, very rarely for any of these does it require an overnight stay.
Does it require getting recommendation from your regular doctor?
I think that's dependent on patients' insurance providers, so I leave that to the billing office to decide.
You don't touch that. You just do the fine stuff.
Correct.
All right, Dr. Lees, thank you so much.
Thanks a lot, Jim.
For the education that you've given us on this. You're having some issues, you know, with like you said, all the way up to your shoulder there, carpal tunnel. Whether you're an athlete or one of those athletes that sits at the computer all day going like that, I'm sure that could work out too. Anyway, give them a call, set up an appointment, and get some relief from Bienville Orthopedic.